Hello everyone, and welcome again. Today I'm going to be talking about the cardiovascular system. So please, if you have your PowerPoint, the PPT, available on hand, I would like you to follow along with me in today's lesson. So today, continuing along, I'm going to also be talking about the medical terminology, and the medical terminology specifically relating to the cardiovascular system. So starting on slide 2, cardiovascular is a term meaning referring to the heart and blood vessels. The word cardio refers to heart. The word vascular refers to blood vessels. So, by combining those two meanings, you get the understanding that cardiovascular means the heart and blood vessels. Cardiovascular structures work together to create an efficient pumping system to supply all the body tissues with nutrients and oxygen and transport waste. The major structures of the cardiovascular system are the heart, the blood vessels, and the blood. On the next slide, let's talk about the structures of the cardiovascular system. And sometimes it might be easier to also, if you skip to the next slide, you can see I included a picture of the heart and labeled some of the important portions of the heart. And so you may need to, and even if not now, maybe later on, you can skip between the two slides, the slide with the picture and then the third slide. So let's begin the slide on the third slide. The heart is a muscular organ which is the size of a fist, and whose pumping action distributes blood throughout the body. It is located behind the sternum or the breastbone and between the lungs. The heart consists of 4 chambers. The 2 upper chambers are the right atrium and the left atrium. The 2 lower chambers are the right and left ventricles. The valves of the heart keep the blood flowing in the right direction, or the correct direction. The cardiac septum separates the right and left sides of the heart. So the septum is a vertical structure, almost like a vertical wall, and it separates the chambers, left and right chambers of the heart. The tricuspid valve is located between the right atrium and the right ventricle. The bicuspid valve is located between the left atrium and the left ventricle. The bicuspid valve is also known as the mitral valve. I like the names bicuspid and tricuspid better because it tells you how many leaflets the valve has. So tri is a prefix that means 3. So cusp is like a leaflet. So tricuspid valve has 3, whereas bicuspid, bi is a prefix which means 2. So there's only 2 leaflets for the bicuspid valve. The semilunar valves are located between the right ventricle and the pulmonary artery, and between the left ventricle and the aorta. The 3 layers of the heart includes the pericardium, which lines the heart and allows the layers to move without friction. The myocardium, which is the middle, thick, muscular layer, and the endocardium, which is the inner lining of the heart. So this is regarding the heart, muscular, and skin layers. So there are 3 of them. There's pericardium, myocardium, and endocardium, from most superficial to most deep. And Then, of course, on the fourth slide, as I mentioned earlier, you have a diagram depicting some of the important structures that we already talked about in slide 3. So please review those 2 slides so that you can get a very good understanding of the heart and those important structures. On the 5th slide, let's continue by talking about some more structures of the cardiovascular system. Blood vessels are tube-like structures that carry blood throughout the body. The arteries are blood vessels that carry blood away from the heart. So I like to tell my students, arteries away. So arteries take blood away from the heart. With the exception of the pulmonary artery, all arteries carry oxygen and other nutrients from the heart to the body cells. The pulmonary artery carries waste products and carbon dioxide from the heart to the lungs. The arterioles are the smallest arteries. The aorta is the largest artery in the body. It originates at the left ventricle and descends through the thorax and the abdomen. So it descends through the chest and the abdominal area. The veins are the vessels that carry blood back to the heart. All of the veins, except the pulmonary veins, carry blood that contains carbon dioxide and other waste products. Oxygenated blood is carried by the pulmonary veins from the lungs to the heart. And just like the arterioles are the smallest arteries, the venules are the smallest veins. The vena cava is the largest vein. So the superior vena cava returns the blood to the heart from the upper body. The inferior vena cava carries blood to the heart from body parts below the diaphragm. And then the capillaries are microscopic vessels that connect the arterioles and venules. Materials are passed from blood to tissue and back through the capillary walls. The blood is made up of plasma and formed elements like erythrocytes, which are red blood cells, leukocytes, which are white blood cells, and thrombocytes, also known as platelets, which aid in the clotting process. The plasma is the liquid portion of the blood in which these cells are suspended. Red blood cells, or erythrocytes, carry oxygen. The leukocytes are the white blood cells which protect against infection, and the platelets, or thrombocytes, are responsible for aiding in the clotting process. As I mentioned the last class I taught, the important thing about medical terminology is knowing the combining form or root word. This is the central word upon which a prefix is attached and a suffix is attached. Prefix always comes before and suffix always comes after. So to understand medical terminology, you must combine these parts like a jigsaw puzzle to form a bigger meaning word. So let's get right into it and talk about some combining forms or root words relating to the cardiovascular system. When you see the word angio, it refers to vessel. In other words, a blood vessel. The word aorta refers to the aorta. That was the largest artery. Arterio refers to artery. Arteriolo refers to arteriole. The word cardio refers to the heart. Corona can also refer to the heart, such as a coronary artery. The word phlebo refers to vein. So a phlebotomist is a person who draws blood from the vein. The word veno, veno refers to vein, and the word venulo also, refers to the venule. On the next slide, let's continue. For vessel, we have angio. Aorta, we have aorto. Artery, we have arterio. For a fatty plaque, we have the word athero. For heart, we have cardio. For sound, we have echo. For electricity, we have electro. For a deficiency or a blockage, we have isco. So the word ischemia refers to a deficiency of blood in the blood vessels. For vein, we have phlebi or veno. For plasma, we have plasmo. For the spleen organ, we have spleno. For heat, we have thermo. For a clot, we have thrombo. So the thrombocytes help in the clotting process. It makes sense. And cyte is a word for cell. So it's a cell that helps in clotting. Thrombocyte or platelets. Valve, we have valvulo or valvo. And for the ventricle, we have ventriculo. Now, aside from some of those root words and combining forms, let's talk about some of the prefixes that are commonly seen and also especially relating to the cardiovascular system. So an means without or an absence of something. The word endo means within. So as I mentioned earlier, the endocardium was the innermost layer of the heart. The word EU, means normal or good. The word pan means all or total. The word poly means many or much. The word brady means slow. The word tachy means fast. So, when someone is talking about slow heart rate, the word bradycardia is used. So brady again means slow. Cardia refers to the heart. On the opposite end, when you talk about a fast heart rate, you could say tachycardia. Again, because tachy means fast, and cardia refers to the heart. So fast heart rate. Next, and finally, let's talk about some of the medical suffixes. So the word algia means pain. The word airy, or eel, means pertaining to. The word seal refers to a hernia or protrusion. The word centesis means to aspirate fluid surgically. The word ectasis means a stretching out or a dilatation. The word emia means a blood condition, particularly relating to blood in the blood vessels. The word gram means to record, or an X-ray. The word graphy means a process of recording. The word meter means instrument used to measure. Metry means measurement. Oxia means oxygen. Pexy means surgical fixation. The word phonia means sound or voice. The word pnea refers to breathing. The word raja means a rapid flow of blood. The word scope means a visual examination instrument. The word spasm refers to a sudden, involuntary muscle contraction, meaning muscle contraction not under your control. The word sclerosis means an abnormal hardening of tissue. The word stenosis means constriction or narrowing. The word stomy means an artificial opening creation. The suffix thorax means chest, and the word tomi means incision or cut into. So this is just a sampling of the prefixes, suffixes, and combining forms relating to the cardiovascular system. This concludes this brief, open presentation about the cardiovascular system. Now, at this time, I would be happy to answer any questions, and we can talk about anything else that might be lingering on your minds. If anything was unclear in this brief lecture, please ask. I would be happy to answer you at this time. Okay, this is me responding to the first question. Thank you so much. So, in terms of electrical application in acupuncture, yes, in the United States and other countries, we do use what we call electrical stimulation with the needles for certain conditions, particularly most commonly used for musculoskeletal complaints, such as soreness or tightness in the back or in the shoulder area. Sometimes we can put the needles and then apply electricity and then allow the electrical stimulation to, do its thing to cause the muscles to contract and relax.
Hi, Philip. I have a question. Can you tell us about your acupuncture clinic experience? Like, what are the most common diseases or conditions in your daily practice?
As Dr. Wei briefly mentioned, there will be a series of TCM English classes beginning on September 14th. And so if you enjoyed today's lecture and the one I gave last time, please join me and my colleague, Dr. Amy, as we teach our class.
And the second question is, in your daily practice, how many patients do you have in one day?
Dr. Wei, thank you for your questions. I'll answer them one at a time. So as for the first question, I have seen mostly issues relating to the problems that Americans tend to have. So problems relating to blood pressure, to diabetes, heart disease, overweight, and of course, just general aches and pains. And of course, when it comes to cold and flu season, people have those problems as well. So those tend to be the things that I see most common in my practice. And in terms of how many patients I see daily, that varies. On a slow day, I can see not so many, maybe like 4 or 5. But on a busier day, I see maybe 12 people in a day. This is fairly average for acupuncturists in America. But some of my very established colleagues who have maybe 15, 20 years of experience may have much more busy practices with maybe 20, 30, sometimes even 40 people. But it's difficult to, see all those people in one day. So in many cases, they will have maybe interns or assistants to help with deneedling or maybe mixing herbs. And in my small practice, I don't need to do that. Okay, everyone. Thank you so much for your attention and your excellent questions. I really enjoyed teaching this mini open series. If you like, you can join me and Dr. Amy starting, I believe, September 14th. You can check the schedule that Dr. Wei has posted. These are paid classes, but I believe that, and I hope you have seen in these lecture series, that it's well worth your money and your time, and that you get a lot out of it, just as we do as teachers. So please do join us. We would be happy to teach, and we can continue this learning journey together. So thank you much, everybody, and have a wonderful, wonderful day.